I'm Dr. Dan Michaels with the Reconstructive Foot and Ankle Institute, and today I'd like to talk to you about wounds. We have a wound care center in each location of our practice, and it's important to have that because a lot of people come in and they have problems with their feet. They have wounds. They have sores or breaks in their skin that go down to their fat tissue, to their bones, to their muscles, and these wounds can be infected and they have to be taken care of, and they're serious things. But in the foot, it's interesting. There's a lot that goes into the foot, and being a specialist in diabetic foot care and ulceration, and having the training in plastic surgery, it really makes a big difference in how we approach wounds. In the foot, it's a lot to do with pressure, and it's a lot to do with physics. And by removing the pressure on most of these spots, the wounds tend to heal. Remember, it's not what you put on a wound that matters; it's what you take off a wound. So if you take off the pressure that causes the wound, that can make a big difference. I'll show you how easy it is to get a wound. If I did this with my fingertip and pushed it on a table, and I just sat there 2 hours, the tip of my finger would become gangrenous and it would die because the pressure of my finger is greater than my blood pressure. So you have 2 hours basically. If you cut your leg off or something, you put a tourniquet on, you have 2 hours to get to the hospital. You can put a tourniquet on for 2 hours before tissue damage occurs. So during those 2 hours, since I have normal feeling, the tip of my finger would hurt a whole lot, and I would probably move my finger and let blood get back into it. But if I didn't have normal feeling, like for example in someone with diabetes, then they don't have that feeling, and they can be laying on their bed and sleeping at night, and then they wake up, and that's how you get a bed sore. 2 hours of too much pressure on the side of the heel, and you'll get a bed sore. You'll have a gangrenous area right here. So that's one type of wound. There's all kinds of wounds that can occur due to poor blood flow, due to too much pressure, or due to your veins not working very well. So we deal with all those, and so your safe bet is to come in to be evaluated. The worst thing that you can do is not come in and try saltwater soaks and Neosporin. You'll make it way worse by doing that. If you wait, then bacteria divide logarithmically every 20 minutes. So at 20 minutes, if you have 1, then 40 minutes you'll have 2, then 4, 8, 16, 32, 64, and it just keeps doubling every 20 minutes. So the longer you wait, the worse it will be. So you want to come in as soon as possible. If you're at risk, if you don't have good sensation, if you have diabetes, if you have poor blood flow, you're at risk. So then you need to come in right away if you have any problems like that. And I explain that to all my patients, that no matter what happens, no matter when, you need to come right in. I'd rather you be wrong and too overcautious than wait. And that way, by doing these little things, we don't have to take people to the hospital, and we don't have to do surgery on them, because really no one likes to go to the hospital. And if we can prevent that, that's really the whole point. We want to prevent any injury, any kind of problem, and if you have a wound, we want to get that hole closed as soon as possible with the least hassle to you. So if you ever have any problems like that, please feel free to contact us and let us help you.